what is the role of genes in this hair fall?
Of course, yes. Genetics plays an important role in hair fall, of course, yes. That's why we call it an androgenetic alopecia. The female pattern baldness or male pattern baldness, that is called as an androgenetic alopecia.
Give me a budget, like, I want to set for every quarter, this much will go for my skincare expenses.
So there are few things called skin concerns. According to that, we used to treat. So the budget also depends upon that. Yeah.
Okay. What is safe? What is not safe for people in their preteens and teens?
If they have acne, because most common concern is
so, what is the ideal age group to start laser hair removal, and how many sittings are required?
Ideal age in the sense once.
Welcome to Feminine Systems podcast, where we not only heal or empower women, we also reimagine systems around her. I'm Dr. Dee, an integrative gynecologist, an author and an entrepreneur. Today, we are diving into a topic, what every woman thinks about, but very few of us understand beyond the creams and Photoshop or filters on a phone. Our skin, the largest organ in the body. From hormonal swings of adolescence to the glow and breakouts in pregnancy, from postpartum changes to the challenges of perimenopause and postmenopause. Our skin is a reflection of our inner rhythm and health. Yet, so much skincare advice is being given, and no one size fits all of us. It is all driven by beauty industry rather than backed by science. That's why I'm so excited to have with me today Dr. Abhirami of B16 Skin and Hair Clinic, who's a dermatologist and cosmetologist from Coimbatore. Apart from being a successful dermatologist, she's also won Mrs. South India 2022. Today, together, we're going to bust myths, talk about what really works on the skin, and explore how skincare can be not just as a beauty canvas, but also skin can be treated as a vital organ reflecting our health, hormones, and even our confidence. So whether you're battling acne, navigating pigmentation in pregnancy, worried about sun damage, or simply curious about how to age gracefully, this conversation will give you clarity, practical tips, and maybe even permission to drop a few products that don't serve you. So let's get started. I see most Indian women are vitamin D deficient. Invariably, if we test them or don't, they are deficient, irrespective of the age group. So, what is the ideal time for somebody to expose themselves to sunlight to get adequate vitamin D as well as be skin protective as well? Because again, going in the sun, the UVA and UVB is again an issue. Right? So, what is the ideal timing?
Yes, ideal time we say 10 to 3. But if you get exposed to that particular time of sunlight, you will get suntan, pigmentation,
Correct.
Automatically skin cancers in long run. So, better you can avoid sunlight, you can take the vitamin D supplements. So, that we used to advise.
Okay.
But because if we want to get vitamin D through sunlight, you have to expose at least few hours a day. For example, 3 to 4 hours a day, at least 4 to 5 times a week. So, if you are exposing on that particular time, you will be getting a lot of side effects. Rather, you can take weekly once of vitamin D supplements.
So, you suggest better to go for a supplement instead?
Yeah.
Invariably, though, 3 to 4 hours of sunlight is necessary?
Of course, yes.
Okay.
Without dress.
Okay.
So, if you are exposing only face, arms and the foot, you won't get enough of vitamin D. Because we had conducted a survey in our hospital. We found out that few people with even a whole day of sunlight exposure, those who are working under sunlight, for those people, they are vitamin D deficient. Even for people
who work in the farms.
Yes,
I've
of course.
Just tested and see. We have also actually it was not like a published study, but we did do it. People who are working even in the farms, though they are exposed to the sun,
they will be,
Okay.
Even if they are in office, no. For those people, the vitamin D is okay. It's in the normal range.
Fine. All of us like to look beautiful. So people in the 40s to 60s, right? So what are the current cosmetology procedures available for them to retain their youth? Because your clinic is called B16. At 40 and 50, I want to look 16. What should we do?
So again, in age group of 40-60, we do some skin procedures that works better. Botox fillers will work for the wrinkles and the sagging kind of thing. Also, there are few procedures that they have to maintain after doing the Botox and fillers. Like say for example, a medifacial kind of thing, peels for the pigmentation, because most of the people after 40 will come with a concern of pigmentation rather than sagging. So we used to treat the pigmentation first. So we need peels and also the medifacials to maintain. Sometimes we need to combine other procedures as a lifting procedure for sagging, like HIFU, RF skin tightening. So that's how we used to give as a combined approach, as a protocol for few people. We do a customized approach for few people, because not only one procedure works for everyone, because Botox will not work for everyone. So we have to go for other procedure. So that's how it works.
When I was a kid, all I knew was L'Oreal, Acne, Revlon. These were the cosmetics. Today we have a million cosmetic brands. And how does one choose a brand? And what are the very basic skincare routine essentials?
Yeah, it's not the brand actually. It's an ingredient matters. Okay, even though it's a good brand, if the ingredient that doesn't suit you, that will be of waste. So you have to choose the ingredient rather than the brand. And if you want to go with a single product, you have to choose a sunscreen, okay, and the moisturizer. The second comes the moisturizer. And depends upon the age, we used to give few serums with ingredients according to their concerns.
Okay, based on the skin type and
of course,
things like
skin
that.
types and the concerns.
Okay,
what they need.
So this has to be very personalized, choice of the routine cosmetics what we have to use, right? Like, so that also we should take a consultation and then pick up your basic cosmetics.
Of course, in the market there are a lot of products we can see. They are promoting much with beautiful packaging.
Exactly. I also wonder how people are making choices. We just assume some brands are good. And they also play with our perception, and eventually we damage the skin as well.
Yes.
Using certain cosmetics, you actually damage without knowing what is what. It is actually more damaging.
Of course, yes. We are getting a lot of patients with a lot of skin damages also because of the products they get it online and they use it for a long period of time. Say for example 1 month or 2 months, sometimes years. They might contain sometimes a steroid that might damage your skin. So that is a problem we are facing right now.
How do you pick a good sunscreen and a good moisturizer? I think something very basic for everybody's skin.
Yes,
right?
yes.
So how do I choose? I think for everybody.
Yeah. If you want to go with the formulations, basically the skin type matters. Even if it's a moisturizer or a sunscreen, the formulation comes first. The formulation means whether it's a cream or gel or the lotion. It depends upon the skin type again. So next comes the ingredients. And in the sunscreen, if you're going with PA++ or the SPF, SPF should be at least 30 for our Indian skin type if you are work inside the office. If you're going out, you have to wear at least SPF 50 plus and PA 3+ would be fine. Okay, that's what we used to prescribe. And regarding the moisturizer, in case if you have any skin damages, you should add a ceramide kind of protective moisturizer. And in case if you don't have any skin concerns, just a gel based or cream based moisturizer with a proper ingredient that suits your skin. That you should consult a dermatologist always before going with the ingredients. You should not choose the ingredient on your own.
Okay. Can you just name some examples of those ingredients? What are the ones which is very specific for this kind of skin?
Yes. Dimethicone kind of thing would be suitable for the acne prone skin in a moisturizer. And I told you, the ceramides. If you have any skin damages, ceramides kind of thing. The moisturizer contains emollient. There will be a humectant. So all combined together should be an ideal moisturizer. And sunscreen, no, it should be a broad spectrum. It should protect UVA, UVB, and physical sunscreen is much safer for smaller kids, and even in pregnancy that is the most safer one. Physical sunscreen in the sense that should contain a zinc oxide, a titanium dioxide, that is much safer in sunscreen.
So how about hair coloring? Is it safe?
We used to get a lot of questions in the hair coloring thing recently. Hair coloring seems sometimes we used to just cover up the grey hair. Sometimes the permanent dyes which will be used to color the hair for just the trending purple, right?
Yeah.
So
Different
if
colors,
you want to
purple, red,
Yes.
all that also.
Yes,
people use.
yes. If you want to just cover up the gray hair, the one without ammonia, without PPD would be fine, because that is the most common ingredient for whom the people will be allergic. So better you can go on with ammonia, PPD and hydrogen peroxide free dyes.
Okay, okay. Hair thinning is a big concern for a 40 to 50-year-old, right? So then again, hair fall for everyone. So this hair thinning, how does somebody prevent it? Are there any home remedies, diet tips which can, help, or supplements they need to take?
Hair thinning happens after a few years of age for both males and females. It is called as a female patterned hair loss for the females. It will be like over the area where we part the hair, or the surrounding area will be, the scalp will be visible. Most of the people say whenever I take bath, the scalp is visible, more visible. So that happens because of the thinning over the area where we part. It's called as a Christmas tree pattern. There is no natural remedy for this. There are precautionary measures to reduce the hair fall. Most of the people have the tractional alopecia along with the androgenetic alopecia. Traction is basically we are pulling the hair. So the hairstyles can be changed to reduce the hair fall.
Okay.
And the products you use, because I've seen a lot of people using tools, hair tools, that will also damage the hair roots. So to some extent, if you reduce that, we can reduce the hair fall too.
Okay.
And third thing, with the treatments, we can reduce it, because basically it's due to the hormone. So just if you want to reduce the hair fall, you have to use some ingredients like minoxidil to prevent the hair loss. So that you have to, once you start it, you have to use it for a very long time. So you should make sure whether you can continue that.
Right. So your opinion on people wanting PRP and things like that. So who are the right candidates for hair PRP and for hair transplant or something like that? Who are the right candidates and when should somebody approach?
Yeah. For PRP, there are a lot of the things that have come up now. PRP, GFC, that is a growth factor concentrate, exosomes, GFC. So these are the things that we do for mostly androgenetic alopecia. Over grade 2 hair loss, even with medications, the hair fall is not getting control, and who are expecting more new hair growth, and also who wants to make the existing hair thicker. For those people, we used to give those growth factors. And about the hair transplant, if already males with having a grade 3 hair loss or more than that will be a preferable candidate for the hair transplantation.
Okay.
Hair transplantation is like a natural hair. We'll be taking backside of the hair as a donor hairs.
Okay.
So since it's a natural hair, that will also grow as a normal hair, whatever they are having right now. So that we can prefer for males. For females with a broader forehead, they can go for the hair transplant. I don't prefer for the androgenetic alopecia for stage 2 or stage 3, I guess, for the females.
Okay. Any food and the supplements which actually prevent hair loss do you recommend?
Of course, protein-rich foods will help to some extent, like sprouts, and iron-rich foods like dates would prevent the hair fall to some extent.
I'm not so fond of dates. Okay, so I'm like so I prefer from animal sources like fish and meat is fine. Even a lean meat, anything. Again, all kind of protein, spinach, beetroot. It's a vegan source, like better to opt for the dates. Because pregnancy and all that we've studied enormously, we feel it is more marketed so much than but iron rich overall really helps. Most of the time, Indian women are iron deficient, so they can actually prefer to improve their hemoglobin levels, which actually translates to the hair fall can be minimized to some extent. Right. And what is the role of genes in this hair fall? Of course, yes.
Genetics plays an important role in hair fall, of course, yes. That's why we call it an androgenetic alopecia. The female pattern baldness or male pattern baldness, that is called as an androgenetic alopecia. Genetics plays an important role. When both mother and father is having the pattern baldness, children automatically will have the hair loss. The hair loss starts early also. That's a problem.
Right. Again, in this menopausal age group, we see a lot of skin sagging and wrinkles, no?
Yes.
So, do you have any other options apart from Botox and fillers for these people?
Of course, for the sagging, there are few machines that have come out with good results, like HIFU, high frequency ultrasound, that will work better for ultrasound. Again, we have to combine the procedures.
Correct.
Not only that,
just isolated one procedure will not suffice.
Yes, of course, yes. We do as a combined procedures. Early sagging, HIFU will work better. Late sagging, HIFU along with fillers will work better. For few people, HIFU and RF skin tightening will work better. For the mild fine lines or wrinkles, Botox would be better.
How often should one come for the Botox injections?
Yes. Botox, it will start waning after 4 months. We can repeat it after 6 to 8 months. Sometimes for few people I've seen for 1 year it will stay, but not completely. Few wrinkles will come again, but they don't want to go for Botox immediately. But once all the effect has gone, we can do Botox. So we can wait till 8 months also.
Okay.
For the fillers, we can do once in a year. Sometimes it will stay for 2 years. I've seen few people that it stayed for almost 5 years, because once the hyaluronic acid is given, it will produce new molecules of hyaluronic acid. So that might stay for a longer period of time.
These threads are also used, right? Like,
yes.
Will it really help here, or they are reserved for very specific conditions?
In threads, there are different types. Okay, so there are cork threads, there are PDO threads, mono threads. So mono threads can just used for regenerating purpose. Cork threads, like lifting purpose, we can use. For those who have a complete sagging skin after 50 years of age, threads and the fillers will work. This combined procedure will work better. So
HIFU will be ideal for 40 to 50, and then these things also can be topped up with
yes.
along all these things. Give me a budget, like I want to set for every quarter this much will go for my skincare expenses. So many people had concerns about skin and how to look.
Yeah.
So at the end of the day, it all again boils down to this is not a very immediate necessity. So how much of I need to keep aside for my cosmetics and my procedures, or just an approximate base level, not necessarily something very advanced.
Yeah, I can understand. But it's not like exact budget which will work for everyone, because
a range probably.
Even we can reduce few things with even 3,000, 1,000. Okay, for few people, if the sagging sets in, wrinkle sets in, with 1,000 or 3,000 will not work, because what I was saying, like, small skin tags and the marus can be removed with just 1,000 budget. So in case if you worry about the pigmentation, just 5,000 to 10,000 will work. So there are few things called skin concerns. According to that, we used to treat. So the budget also depends upon that.
Okay. Let's go something for the teenagers.
Okay.
Because these moms will be like having kids who are in that age group. So the teenage girls. Now adolescent people start using all kind of cosmetics, right? So what is safe? What is not safe for people in their preteens and teens? Because now not even teenagers, people at 8, 9 start using cosmetics. Girls start using it. So what is safe? What is not safe?
The safest thing in the sense, if they have acne, because most common concern in teenager is acne. If they have acne or acne prone skin, they have to choose the moisturiser and the sunscreen wisely. I don't say it's compulsory for them, because for few people, whoever has having an allergy to sunlight or having a sunburn, or sometimes they will be involved in sports activities for most of the time in a day. For those people, I do prescribe sunscreen. Otherwise, I don't ask them to use the sunscreen regularly. Only the moisturizer would be enough. If they have acne, we have to treat that with a few ingredients, and then they can use the regular products like moisturizer and sunscreen. That would be enough, but it's not compulsory for them.
What is your take on this foundations, then compact, then people use serums? So these are what at least commonly used apart from moisturizers and sunscreens, right? So what is your take on that and the effects on the skin?
The foundations, basically, it will absorb the moisture from the skin.
Okay.
After applying and removing, you can feel the dryness of the skin. At least not at that day. After a few days or later, you will feel the dryness. So basically, I don't say you should not apply, but before applying that, you should apply the moisturizer.
Right.
And immediately after removing that, you should apply the moisturizer. That in that way we can protect the skin. Okay. Other products, like I've seen few people, even the teenagers, what you were asking, they have kept a lot of serums and a lot of creams in their cupboards. Yeah.
I really don't know the names of the products, okay, because they have something for the, dark circles. There are many things which people use. For half an hour, my skincare routine.
Yeah, so there will be steps in it.
Correct.
9 steps.
And all the Instagram influencers also, this is my tip that's making me look be very pretty and all that. I mean, what do you suggest?
Most of the influencers, they will be wearing the coat and showing that they are the doctors.
I made it a point, like, people to really know it's coming from a credible source. We are also trying to wear a coat instead, which we are not at all wearing in our practice. Not at all wearing it daily. And scrub sometimes. So these things, so that really we need to, tell, we are also doctors. We are doctors. But otherwise, most of the time the influencers are looked like gods, and, all the decisions are so people make, and doctors don't have time to, and we only see, I'll tell you, people, when you follow these influencers and you subject your health and your skin to a lot of damage, at the end of the day then you come to the doctor. Since we don't have the time to really reach out, so at least in that kind of thing we have taken an effort in such podcast and things like that.
That's good. At least people are taking such kind of efforts to create awareness among the people,
at least from some, especially because even I can give some inputs, but I'm trying to bring in experts in each niche to really get their point of view, and so that let the audience talk to an expert itself directly. That is the idea behind.
That's a good thing.
Right? So even I'm a doctor myself, I don't want to give you every damn advice on every specialty.
I cannot give advice regarding the uterus or kind of problems, right?
It is better because it's so evolving. Many things are changing. It's better people also consume content which is from a reliable source than the most well-edited, most popular, right? I asked about this hair serum. I mean, the serums and all for the face.
Yes.
Do you think it is effective or it is needed? Or what's your take on that?
Serum is a formulation kind of thing. Okay. Even in the cream, the same ingredient will be present. So whether it's a serum or cream, the ingredient matters. Okay. So in case if you are using the serum for acne, the ingredient will be like azelaic acid or some other acne ingredients. So in case if you are treating the pigmentation, depigmenting creams like niacinamide will be there, other things will be there. So the concerns and the ingredient matters. Okay. So not the formulation. The formulation depends upon the skin type.
Fine. So, are they actually needed for a normal skin, or it's very specific people only need it?
Of course, yes. We need that even for the normal skin
serum
to protect. Serum or creams. Either it's a serum or cream. Even for the normal skin, we need to use, because sometimes at the age of 30, we will feel like, am I aged? Or is it okay to use a cream or a serum now? Because there are many questions that will be arising in their mind.
Right.
Okay.
Right.
So at the age of 30, we have to add a retinol or vitamin C as an anti-aging ingredient, even without any concerns.
Okay.
So it depends upon the age.
Okay. Interesting. Again, for teenagers, as you said about acne, what are the treatment options you have for acne? For girls and boys.
There are a lot of the treatments for acne. Even 80 to 90% of the acne will reduce. Sometimes with the creams alone, it will reduce. In clinic treatments like peels, lasers will work better. Peel is my favorite.
For acne.
Yeah. Because we do the comedone extraction initially. That is the initial stage of acne where we remove the acne so that the next time they come...
It's safe for teenagers also.
Of course, yes. That is very safe. The comedone extraction and the peels are very safe even for teenagers, even for the adult acne. Again, the lasers, for if they are having a single acne, if they are going for a wedding or so, if they want to reduce it soon, within 2 to 3 days, that will reduce. That is called as an erbium YAG laser. If they have a pigmentation, again the peels or Q-switch laser toning would be fine. Apart from lasers and peels, creams work much better. Okay. So for acne, we need a combined approach. Sometimes tablets also needed.
Right.
tablets, creams.
Sometimes, if this acne or excessive facial hair, they can be a manifestation of a polycystic ovarian syndrome, the PCO type. So that hormonal workup also sometimes is needed. It's like just because you're in the adolescent age group, the hormonal effect, you're having your acne, or is it a metabolic rearrangement like a PCO which is manifesting, or because of the skin type, people are prone for developing acne. It is like you have so many other options, like as you said, like laser and peels. So these can be considered when you have a very troublesome acne, right? So most people, they go buy all over the counter creams, right? Most of the times, and predominantly all retinol creams, they abuse it very long. They don't really want to take a consultation. Sometimes, they just don't take that very medical advice much seriously, right? So, and sometimes they even go to a GP and just ask, let me take this. So they don't want to go to a specialist to really ask. Since I spoke about PCO, hirsutism, the extra facial hair, what are the treatment options we have for that hair removal? Hair removal in general, people opt for lasers and all. Which laser is good? How do you choose that? And especially facial hair also.
Yes. Hirsutism kind of thing, there will be excess of facial hair in the male growth pattern. That is basically hirsutism. They will be developing hair over the upper lips or the lower face. So they will lose confidence.
Correct.
Because of that, what we are going to do is laser hair reduction. That is the best we say. Other than laser hair reduction, there are few hair removal methods like waxing, threading, and shaving. These things, what it will do, it will damage the hair, and also it will damage the adjacent skin along with the removing the hair. So there are few people that have come out with pigmentation, ingrown hair. When you touch that particular area, when you have seen that particular area, you can see small bumps over there. We can easily visualize that they have removed the hair. So that is a problem with waxing or threading, because they are pulling out the hair. Automatically it will damage the surrounding epidermis.
Correct.
So there will be some sort of pigmentation.
And
yeah.
Sometimes some edema is also seen, right?
Of course, yes. So laser hair reduction is the best option. In laser hair reduction, we prefer diode laser and then a triple wavelength laser, and sometimes the IPL. We are having all three here. So that depends upon the hair types. Sometimes it will be a terminal hair, like thick hair and coarse hair. For those people,
they say it's
with
more effective hairs, with the thick coarse hair kind of thing, right?
Yes. Much effective. Once the thin hair starts, there comes the difficulty in reducing, because no other procedure will reduce the thickness of the hair. Only the laser will reduce the thickness of the hair. Once it gets thinned out, most of the hairs will not be visible much.
Correct.
Some people want to reduce the fine hairs too. So there comes the triple wavelength or IPL. So in that point of time, we need to change the wavelength of the laser.
So what is the ideal age group to start laser hair removal, and how many sittings are required?
Ideal age in the sense, once the menstrual cycle started, 3 months later, after the 3 cycles are gone, we can start the laser hair reduction.
As early as, an adolescent can opt for it.
Yes. For few people, for the underarm, I used to say I don't regret doing underarm laser hair reduction, because they will be happy about doing that after a few sessions. Yeah. Because most of the people will have the difficulty in wearing dresses.
Correct.
So every 15 days they have to remove the hair with waxing or some sort of of course, yes. As I said before, it can cause a pigmentation because it is damaging the upper layer of the skin.
Correct.
So once in a while we need to remove with a shaving, or so laser hair reduction is an advantage. So it will grow only after few months, even though there will be a thin hair only. So there will be thin hair, only 4 to 5 hairs will grow.
How many sittings are required?
6 to 8 sessions monthly once. After that, in case if they want maintenance for the thin hair, they can go like 3 months once, 8 months once, sometimes 1 year once, depends upon the person.
About the intimate area hair removal. So bikini waxing was there, like previously all it was very common. So what is your take about the intimate area hair removal?
Recently I've come across few people after 40 years, they are developing chronic itching over the pubic area because of some disturbances, because of the hair rubbing over the inner wires they are wearing. So after doing the laser hair reduction, they were much comfortable with literally no itching, because the laser actually removes most of the hair. The hair will not grow back. Right. Automatically, they will be free of hair, free of shaving, and free of folliculitis.
Absolutely. That's what I also wanted to mention, because what happens, most people try to shave. So that folliculitis, a lot of people come with folliculitis. They have like boil in the intimate area, the vulval area and all. It is a troublesome thing. It forms like a small abscess, like a pus, and it's very painful also.
Yes.
And next, another thing would be, what happens is people use the creams. They are very harsh there, right?
Yes.
Even that is again a big concern, which I used to tell them, like sometimes, if people who are not opting for a laser or something, you can go for a hair trimming kind of thing, which is more safer at that place. And not to use all these vaginal washes which are available. The normal bacterial flora which is there has to be preserved, because that actually helps your the overall hygiene out there and your health. Because like what we say, the microbiome, the vagina also has a lot of commensals of lactobacillus, the good bacteria, and again this area also. I think these things, preferably people don't use too much perfumed creams out there, or people even use perfumes there. That's what.
Yes.
Right. So these are things to be avoided for an intimate area care.
Yes. Because we have seen people using creams for the hair removal comes out with irritant contact dermatitis because of the creams.
Right.
Because cream is a big no for that particular area. Even if you are not opting for laser hair reduction, the shaving would be enough, but not the reverse shaving. In the direction of the hair, you can shave to prevent the folliculitis.
So most of the time we just go for a nice thin scissors and do a trimming, if that because for people, at least once they get follicles, then they're not able to wear their panties well. Then the sexual experience is bad and all that. Could you tell us about the skin changes in pregnancy and what are the treatment options like we have for melasma and linea, nigra and all that?
Yeah, in pregnancy we have seen a lot of patients with acne, mainly the pigmentation called melasma. So acne, the
pigmentation out here, some dark pigmentation here, very typical. People develop during pregnancy.
We say the butterfly patch of pigmentation over the nose and over the cheek, that is called as a melasma. So for acne, the safest ingredient will be clindamycin and azelaic acid. Again, in melasma, we give azelaic acid as a safe ingredient
during pregnancy.
So, in pregnancy particularly.
And they're also concerned about stretch marks and that linea, nigra that happens again. So
of course, to prevent stretch marks, we do advise just massaging with the normal moisturiser, whatever they are applying. That will prevent the stretch marks. Once stretch marks comes in, we cannot treat during pregnancy. After pregnancy, we can treat. There are a lot of the procedures to treat it.
Yeah, could you tell us about those procedures, and after how many months in the postpartum should they come for those procedures?
Yes. Creams will work, but not much. Retinoids and everything as a peel, that will work, but the particular procedure for this is we use resurfacing lasers like erbium YAG, CO2, fraction CO2 will work, and the carboxy therapy will work. We used to ask the patient to come after 3 months after delivery for the treatment. Lasers we can start it after 3 months, but the carboxy therapy, once they stop the lactation, that would be safe.
For laser, how many sittings have to come for the stretch marks?
At least 6 to 8 sessions. For carboxy therapy, 8 to 12 sessions are needed.
I want to ask you some personal questions. You've been Mrs. South India 2022 Queen of Hearts. So could you tell us about that experience of taking part in a beauty pageant?
Experience, before going to that industry, we need to prepare for it. That is the most difficult part, because we have to be on stage along with other beauty pageants. So we have to be fit about the body, and also we have very clear skin, and we have to have a very confident look on stage, right?
Correct.
So for that, at least to prepare. So before going on stage, I have done few things. Basically the workout. Early morning before coming for work, after sending off the kids to the school, I used to go for the workout. At least 1.5 hours a day I used to do that. And I completely avoid sweets because that will cause acne. Sugary items can cause hair fall. So I completely avoid that. I had a regular sleep and a good diet pattern. And along with that, the skincare and also few procedures I've done before going into that, particularly the fillers. We say the modeling look. We do give contouring for the cheeks and for the jawline. I did before going on to it. Also kind of procedures like medifacials and peels I did. There are some difficulties to enter into because there are various stages. The initial part will be like there are many people. Upon the many people, we have to one among them. So they have selected around 150 people. So they have segregated like 50 people among that. And then 10 among that. So that kind of category, in each round we'll be having a fear whether we'll be
Go to
getting
the next
selected
round.
to the next round or so. But I have a confidence in mind that I've done few procedures that might help. So actually that helped a lot. Regular consistent skincare, along with they will have a holistic approach, like even the celebrities will do. No, likewise I did. I maintained everything in order so that I have to be confident on stage.
Wow, this is very interesting and very offbeat also. Not many doctors, want to or have the time to put
course,
so
yes.
much. It also requires a lot of time and effort, commitment. There is you need to stick to certain even diet routines, which is very hard to do, and balancing with your kids and work. So I think it's very inspiring for our viewers to really motivate more people to take part in such things if they are very interested. It's not necessarily it's for everybody. If somebody wants to, I think they should go for it. That's all.
Yes.
Yeah, right? So,
Right.
It's nice, very nice. You've made Coimbatore proud, so.
Thank you.
Let's go to rapid fire now.
Okay.
I thought I'll do a lot of rapid fire with you because everybody will be interested to know more about skin actually. So rather than long lecture talks, I thought a rapid fire would be better.
Yeah, okay, let's go.
Do pimple patches really work?
Of course, for few people, if the acne is very large and if they have a big event, it will work. It will just reduce the size of it, but not the infection.
Is makeup safe for daily wear?
Safe in the sense, if they are using a right product, it's safe.
Best affordable cleanser ingredient for oily skin?
Salicylic acid.
Sunscreen, cream, gel or spray? Which is your favorite?
Depends upon the skin type, but I prefer gel.
How early to start anti-aging care?
As early as possible. Say for example 25.
Pregnancy safe skincare myth you often hear.
Don't use any other creams.
Stress, sleepless nights causes skin damage. True or false?
True, absolutely true.
One skincare step which busy women should never skip.
Sunscreen.
Retinol, it's a miracle or marketing?
Miracle actually.
Dark circles, creams or procedures?
Procedures.
Do expensive facials in the salons and spas pay off?
Not much. Because medifacials we do according to the skin types.
What is this Hydra facial and all this latest Hollywood facial, and there's a lot of hype about it.
Yes.
So what are they?
Actually, hydrofacials will not work for acne or the pigmentation. It will just exfoliate your skin, but you have to look for whether it's an original hydrofacial or the fake one.
How do we differentiate?
There will be authenticity certificate with the doctor.
Because now all the salons and spas are offering that.
Yes. Even with 30,000, they can buy the machine. But the original
Many
hydrofacial
Chinese machines are around, right?
Yes. But original hydrofacial cost many lakhs.
Even a
serums
good
also.
laser machine costs very significant, almost half a crore it comes like when you buy it together. Like
of course, it's a good laser machine.
Yeah, right? Hormones or skincare in perimenopause, what drives the change?
Both.
Dry for dryness, moisturizer or oils?
Moisturizer.
Your opinion on aloe vera moisturizer?
Aloe vera is a common ingredient used in the moisturizer, but the aloe vera alone will not act as a moisturizer because there are few things called humectants, emollients. So basically the moisturizer should contain occlusives, emollients and humectants. Aloe vera will not do all these three works.
Is collagen powder hype or help?
I say hype.
For collagen, I think we really don't know where it goes and gets deposited.
Of course, yes.
What is your opinion about IV glutathione?
Actually, IV glutathione, if you are expecting for whitening, that won't work. That will reduce the melanin to some extent. That will give a glow to some extent. That's how they are claiming that it will work for the whitening purpose. It will not change your skin tone completely, but to some extent, you will get a glow. That's it.
And once you stop it,
You need to continue at least with the tablets or sprays.
Is it too late to start skincare after 50?
Of course, yes. It's too late.
Which procedure gives fastest glow?
Fastest glow? Nothing.
Daily ritual that makes the biggest difference in the long term.
Daily ritual.
Yeah.
Sunscreen, obviously.
Should women over 50 still exfoliate?
Yes, they need to, because for the new skins to come again on the top, you need to exfoliate. But not the physical exfoliation, the chemical exfoliation would be better.
Skin care splurge worth every rupee. Can you name one?
Retinoids,
Okay.
sunscreen, that too the physical one, and the moisturizer.
One ingredient every woman should swear by.
Again, the sunscreen.
Ingredient.
Ingredient, retinoids or vitamin C.
Is oral vitamin C as helpful as on the skin?
Of course.
Overrated skincare product.
As of now, snail mucin.
One skin habit you wish women stop doing?
Over exfoliations like using loofahs, trying to reduce the pigmentation with scrubbing.
Your opinion on applying turmeric for the skin?
I will say no. Because turmeric, if you have it in food, that will act as an antiseptic also. If you apply on the skin, that will act as an allergen.
Celebrity skin secret that actually works?
Holistic approach, like applying creams, they will sleep early, and they will have a good diet, so everything comes into play.
And with all the procedures and things,
of course,
right?
yes. They do a lot of procedures for their skin.
We really talked a lot about all the latest techniques and procedures in cosmetology. But if people want to do some self-care, home care preparations on their own, anyways, people will start do, because we are traditionally used to something like the moong dal powder and all, and which people think that is the best thing to go for. And again, with turmeric and these Ayurvedic scrubs which are homemade, where they use all these dal, rice, and sometimes even tamarind. So these things. So what is your take on it? And could you give us 3 home remedies for good skin care?
Not 3, I can name 1.
Okay.
Aloe vera is okay because it will act as a
Just
part of
plain
moisturizing
aloe vera.
thing,
Okay.
and a part of anti-inflammatory that can also prevent acne. That is a good one to apply for the skin or the hair. But sometimes, even for the natural ingredients, people will be allergic to. So you have to be very careful while using even the natural ingredient. Sometimes people used to have that moong dal scrubs. They will create the tiny injuries over the skin. So automatically that will turn into pigmentation later on. Over a period of years, that will create a pigment called macular amyloid kind of pigmentation. So we used to advise, don't use that kind of scrubs at home.
No, people believe it's homemade, so they think that is more safer, that is real, natural. So they think that can be, applied and it doesn't cause any damage.
Right. Sometimes
and turmeric also, right?
Yeah. Sometimes the natural ingredient itself will cause much of damage rather than the chemicals. Okay. Like you say, the turmeric. Turmeric is an antiseptic when you have it in food. But when you apply it on the skin, that will be an allergen. Yeah. That will itself create the pigmentation.
Turmeric has like that anti-inflammatory property which actually helps for recovery, but when you do it on the skin, it is really
it will damage,
right? So what is your opinion about milk on the skin? People apply milk, curd, fruits, bananas to oranges, papaya. So they apply that to make them glow. So what is your opinion, take on
milk or curd? If you're acne prone, don't apply because it will create more breakouts. So best to avoid. And other ingredients like lemon, sometimes they will keep it on acne. I've seen a lot of people keeping garlic or lemon for the acne for the immediate cure, but actually that will cause an irritant contact dermatitis rather than curing the acne. I don't advise much of these home remedies for the skincare.
Yeah, and what is your opinion about these oils where there's curry leaf, hibiscus, and many other herbal oils which is being marketed as well, and people make it at home also, applying coconut oil to the scalp as well as these herbal oils. What is your take for hair growth?
Oils, actually, it will prevent the hair damage. Like the hair shaft, the part we can see outside is called as an hair shaft. It will not work much on the hair root where we get the growth, because if you are aiming for the hair growth, the oil will not work much. In that way, in case if you are just working on preventing the damage to the hair, the oil works better. Again, the ingredient, I prefer just a coconut oil, not that kind of hibiscus or the curry leaves.
And there many varieties of leaves like herbs are there. No? They're using it, make, and all these influencers are making that in the
as a main ingredient for the hair.
They're making everything. They prepare the oil and show, and they sell like some 1,000 bottles of oil. So are they really any effective?
The oil will just coat the hair, will coat the cuticle. That will prevent the damage. It will not work on the hair root. In case if you are mixing even the hibiscus or the curry leaves as a natural ingredient to the hair, that will just coat the hair. The coconut oil, again, if it's mixed with the hibiscus, it won't work better. Again, it's going to do the same work, whatever the plain coconut oil is doing.
What is your take on the face pack?
That won't work much. We say it's a hype.
Do they damage the skin?
Sometimes it can, because we know there are few ingredients that can damage the skin. Even the multani methi kind of face packs are commonly used, widely used in South India. That will make the skin dry. Even for the oily skin, if it's making dry, skin will think that my skin is very dry, so I I have to secrete more oil. Automatically for the oily skin, if they are applying multani methi, it
worsens.
Yeah, it worsens because of excess oil production.
Okay, so that is one of the most commonly sought after, ubuktan powders. So many companies sell. They promote it for children also.
Of course.
So it is actually causing more damage.
Yes.
Right. What is your take on peptides?
Peptides, yes. Peptides will work for hair and also the skin. Again, it depends upon the concerns.
IV or oral?
I prefer topical peptides and serums like we do as a mesotherapy. Peptides with meso solutions. So that is most preferable one.
I think I had a very, very meaningful, insightful discussion with you on the latest cosmetology procedures to hair care and skin care on a regular basis across age groups, be it a teenager or somebody in their young age. 25 you start your skincare anti-aging treatments is what is you suggested. Again, perimenopause and menopause when our hormones are declining. So I think it's even for me quite a bit of learning because when we are in a particular specialty, we focus on that and we become experts in that area. It was very, very meaningful, and thank you, Dr. Abhirami, for your time and gesture to be part of our Feminine Systems podcast. And I think you've really going to make a big difference to our viewers as well. Thank you so much, and pleasure to have you.
Thank you for making me a part of creating this kind of awareness about the skin.